get them to smoke cigarettes. And all of it turned out to be untrue when we finally got the behind-the-scenes documents and testimony from people working in the industry. And we also found out at that time that cigarette smoke was harmful to the non-smokers, and therefore there couldn't be no justification for people smoking and thinking that the non-smokers should just have to put up with it. That hearing, I think, had a dramatic impact, as many oversight hearings do, in changing the public image of tobacco. People realized they were these suits, these business people who were making money in a very cynical way by getting people, especially children, to smoke and then getting them addicted and then killing so many of them with all the diseases related to cigarette smoking.
Do you think we'll ever see the same image of the swearing in of the health insurance industry executives? Would you like to see that day?
You know, I don't think it's comparable. I think health insurance practices have to be changed. I think it's wrong when they exclude people from coverage and try to rescind their policies. We need to regulate them.
I mean, isn't the figure 18,000 people die a year as a result of not having health insurance?
And that's why we need a health insurance bill. But it's not because you have insurance companies that could do a good job. They don't have to waste as much money on excluding people from coverage, but they can negotiate rates. They can do things to provide the delivery system for health care so that we're not spending more money for services that aren't really needed. So don't demonize the insurance companies. I think that's unfair. I would demonize the tobacco companies because there's nothing you can say about tobacco where they serve any useful public purpose. On the health care bill, I don't want the perfect to be the enemy of the good. I don't want another 15 years before we can deal with the issue of health care for the uninsured in this country. We've got to do it now that we have leadership from the President of the United States and a Democratic Congress. We're not getting much support, if any, from the Republicans. Let's get a system in place, and we can change it later, but let's do the job of getting a workable health insurance system for everybody to have access to the services and needs that they might have.
And it would go into effect when? In something like 2013?
It would take, certain things would take effect immediately. A lot of the insurance regulations would take effect immediately. A lot of the public programs would take effect immediately. We put a lot of emphasis on public health and preventive services and training new primary care physicians. But the crux of the bill with the exchange and the insurance options will take a couple years to put into place. So I think it's 2012 or 13 when it would be fully in effect.
And your bill still has to be melded together with the other House bills and then reconciled eventually with the Senate bill.
Right.
Are you worried that, I mean, first of all, that the public option can survive all this different reconciling, and are you worried that the bill will get watered down continually so as to lose a lot of effectiveness? I mean, you write about this in the book, in the danger of trade industry lobbying, and they're lobbying very hard right now. There's a whole month now of August where you know, the lobbying campaigns will be increased. What do you see as happening with the final legislation?
Well, I would have preferred we voted on the bills in the House and the Senate before the August period where Congress is no longer in session. And then we would come back in the fall and work on the details in a conference committee. Well, that's not going to happen. We'll come back in September. We'll pass two very different bills in the House and the Senate. And you know what? The conference committee is going to be able to do anything and everything we want. Speaker Pelosi has said she demands that there be a public option available to people, not just private insurance options. I think it's important to have it because it keeps the private insurance companies honest. They'll have competition. In many parts of the country, you look at the insurance available, and it's usually Blue Cross or Blue Shield. 80% of the market could be one insurance company. Competition is what holds down costs and brings about better quality. And I think that's an important thing for us to accomplish in the legislation. I worry about it getting weaker. I expect in the Senate it's going to be a weaker bill. But when we get into conference, the President is going to be there and we'll be there as well. We're going to demand it be a bill that lives up to what we need in this country.
Public plan, the bottom line for you? that there is a public option?
I want a public option.
Will you not accept, like the progressive Democrats have written a letter saying they will not vote for anything but a public option?
I don't like drawing lines, but I expect we're going to have a public option. But the essential thing is we get a bill that's going to make sure that everybody gets health insurance. And I think the public option is a way to get the competitive forces to hold down costs and to make sure that there are different systems that will compete on quality.
Now, your other key legislation that passed in June that you introduced, Waxman-Markey bill on climate change, what are the main provisions of that bill?
The Waxman-Markey bill, or the Energy Global Warming bill, had three objectives. We wanted to reduce our country's dependence on foreign oil. This is a matter of our national security. We're so dependent on importing oil from the Middle East that we've really lost our ability to stand up to the Saudis because of the fear that they could cut off our oil. And we're dependent on other countries in a world market where Iran gets billions and billions of dollars, which they're using to develop nuclear weapons. So we need to become less dependent. Secondly, we need to reduce the carbon emissions. Global warming is a much more serious problem than most people realize. For the last 8 years of the Bush administration, they denied that there was such a thing as global warming and censored scientists who talked about the problems from global warming. We've got to deal with it. We've got to deal with it as a leader in the United States, not one that's hiding from the reality, and we've got to then work with the international community to reduce carbon emissions. And then thirdly, there are going to be millions of new jobs when we start making investments into technologies that can hold down the carbon emissions. We hope we can use coal and develop technology that can sequester the carbon from coal. We hope that we can use alternatives and become much more efficient in the use of our fuels, and in that way reduce the carbon and avoid the increase in carbon, and make sure we can turn that curve down and get to an 80% reduction, which is what the scientists tell us we need if we're going to avert the harm from global warming by 2050.
Well, on the issue of emissions cuts, I mean, the bill has come under criticism for the level of percentage that it's set to a 2005 level and not the Kyoto standard of 1990. The Intergovernmental Panel on Climate Change has called for greater cuts. What do you think about the level of cuts that are recommended versus what's in the bill?
We provided for cuts, but then we provided for additional offsets so that when the President of the United States goes to the Copenhagen conference, which will be a follow-on conference from Kyoto, he can talk about the United States getting a 20% reduction and even 25% reduction in global emissions. And that will put us where the scientists tell us we need to be. We try to get the reduction numbers based on the science, and it's been a struggle. And we had to make some concessions to get the bill through the House. But we found another alternative that could add to the reductions in addition to the number we achieved for the first tranche of reductions.
Congressman Waxman, on the climate bill, one of the arguments of progressives was that the measure started out strong but was gradually weakened by industry lobbying. I want to play the comments of Tyson Slocum of the group Public Citizen, which criticized the bill. We interviewed him on Democracy Now! About a month before the House vote.
Part of the problem was there were a significant amount of meetings that occurred behind closed doors in between the time that Chairman Waxman and Markey released their draft bill in March of this year, and then they released a significant revision just last week. And in those closed-door meetings, they met with representatives of the oil and coal industries, and significant numbers of concessions were made. Look, Public Citizen supports strong, effective climate legislation, and the fact is that this bill does not do that. We can talk about the aspirations of hoping to achieve greenhouse gas emissions reductions, but when you look at what this bill will do, it will not result in significant reductions. It creates a legal right to pollute for industries and gives away credits for free to allow companies to meet those targets without having to pay for them. And that is simply not going to spur the kind of investments we need. President Obama had it right when he announced in his budget in February that if you wanted to pollute, you would have to pay for the right to pollute. And by holding an auction, the government would raise hundreds of billions of dollars that could be reinvested back to the American people to offset the impacts of higher energy prices that a cap-and-trade program would bring,